Hello, my name is Matt Barnes, and today I will discuss the positive and negative psychological effects of anabolic steroid use. There are a variety of influences that affect an individual's choice to potentially use anabolic steroids. These two quotes provide brief insight into some of the polarizing opinions that either positively shape or hinder rationalization of steroid use. During this presentation, I will discuss what anabolic steroids are, various reasons and situations as to why they might be taken, psychological effects, both negative and some positive, and then objectively discuss the facts and information on anabolic steroid use. Anabolic androgenic steroids, what are they? Commonly known as roids or juice. All steroids are derivatives of synthetic testosterone. Steroids possess both androgenic and anabolic properties, and they all bind to the same receptor. Androgenic development refers to the development of male characteristics by male hormones. Anabolic refers to the chemical reactions that synthesize molecules in metabolism, enabling tissue and cells to grow. Anabolism has little effect on characteristic development. Over the years, some steroids have been engineered to exhibit more anabolic properties and fewer undesirable androgenic side effects. The lure of all the physical and societal accolades associated with elite performance can entice individuals to change their ethical standpoint on anabolic steroids. Ben Johnson, a 100 metres former gold medalist and convicted steroid user, was the initial winner of what was named the dirtiest race in history. He was stripped of his gold medal 3 days later after testing positive to anabolic steroid use. 4 out of the 5 finishers of that race have since tested positive for banned substances. He stated, "I'm saying 40% of people in sports are still using performance-enhancing drugs. I think that, based on past experiences I have had. It is not only track and field, there are soccer players, football players, basketball players, and cyclists, and you would be surprised that some of the great players are doing stuff." If this statement is accurate, then outside of regulated sporting organisations, anabolic steroid use must be far more prevalent. This opens up to a large group of people to potential psychological injury or illness. The physiological changes that occur as a result of anabolic steroid use are readily understood and studied. However, both academia and society as a whole lack understanding of the psychological effects that associate with steroid use. Like any substance, a variety and combination of physical, emotional, environmental, and social factors all influence an individual and their decision making. There are many positive psychological effects of anabolic steroid use. As physical performance and prowess increases, so does an individual's self-confidence. Individuals report feelings of invincibility across many studies whilst taking steroids. This increase in self-confidence and invincible feeling gives an athlete not only a physical but a psychological edge over their opponents. In the sporting arena, money and fame go hand in hand when associated with elite performance. Obviously, it feels good to receive these rewards as a result of high performance. Through positive reinforcement, this strengthens the positive emotional association to steroid use. Anabolic steroid use causes dramatic body composition changes in a short period of time, resulting in individuals starting to look and feel better. An improved aesthetic-looking physique increases social perception, further reinforcing self-confidence and a sense of well-being. Another side effect is increased libido, which, depending on this individual's situation, may be a positive psychological effect. It is common knowledge that as men age, testosterone levels decline and libido, amongst other traits, follows suit. If a person with a low sex drive suddenly has a libido of someone in their late teens, early 20s, it increases confidence, well-being, and feelings of self-worth. It empowers individuals who may have suffered emotionally for a long period of time. During steroid use, some even report increases in concentration and mental state, resulting in improved academic performance and skill acquisition. Although there are some positive psychological effects, studies have documented many negative psychological conditions associated with steroid use. High levels of steroid use affect various cell types, including neuronal cells. Individuals using high-level doses of anabolic steroids increase the risk of possible irreversible neuropsychiatric toxicity. Anabolic steroid abuse appears to be associated with a range of potentially prolonged psychiatric effects, including dependence syndromes, mood syndromes, and progression to other forms of substance abuse. However, the prevalence and severity of these various effects remains poorly understood. Major depression is a consistent psychological side effect evident throughout the majority of studies on anabolic steroid use. Its presence is more prevalent at times of steroid use cessation when compared to times of use. Some studies showed up to 23% of participants demonstrate depressive mood, manic, and hypomanic episodes. Clark and Henderson, amongst others, reported a relationship between hormone levels and the emotional dispositions and aggressive behaviours of adolescents. The results indicate that high hormone levels were related to potentially adverse psychological consequences for both boys and girls. Anabolic steroid associated withdrawal and dependency disorders were also reported. Sari, amongst others, described that both physical and psychological side effects, similar to those seen in opiate withdrawal, were experienced upon ceasing high steroid usage. Steroids may be psychologically addictive and in some cases even meet the criteria for psychoactive substance dependence. This addiction can manifest into a condition known as muscle dysmorphy, which is a mental disorder primarily affecting males. It is characterized by obsessions about a perceived lack of muscularity, leading to compulsive exercising and rigid diet routines. The developing nervous system of adolescents may also be vulnerable to the psychological effects of steroids. They may lack the maturity to cope with possible drug-induced mood changes and affect the development of appropriate social skills and controls necessary to deal with hormonal changes to their body. Studies highlight the first generation of anabolic steroid users of the 1980s are soon hitting an age where they are at risk of psycho, neuro, and/or endocrine complications. Kaneyama, Brower, Wood, Hudson, and Pope found that neuroendocrine function may require reactivation as a result of hypogonadism. This is due to the presence of exogenous testosterone and subsequent downregulation of the body's organic testosterone production. Pagonis et al.'s recent study on individual psychometrics showed that although the psychometric subscales were recorded increased, there was no statistical difference from anabolic steroid abusers when compared to non-users. However, they did prove that there was a correlation between severity of abuse and the magnitude of side effects demonstrated. It requires further investigation to completely understand the strength of this relationship. Various studies have reported both positive and negative psychological side effects of anabolic steroid use. Although a relationship between use and psychiatric effects exists, further studies must be conducted to explain prevalence and severity. If desired, you can use the following reference list to further expand your understanding of anabolic steroid use and its psychological effects. Thank you for listening.